The Alberta Strategic Clinical Networks, also referred to as SCNs, are provincial programs advancing improvements and innovation in specific areas of health, which consist of networks of people who are passionate and knowledgeable about improving the delivery and quality of care to improve health outcomes for all Albertans. What is the role and impact that patients and families have in the SCNs? This is episode 19 of Pep Talks, the Patient Engagement Podcast. In this episode, recorded in the summer of 2020, we speak with Tracy Wasylak, the Chief Program Officer of the Strategic Clinical Networks for Alberta Health Services. Paul Ferry first asked Tracy about what the Strategic Clinical Networks are and what role they play at Alberta Health Services.
The Strategic Clinical Networks, or what we call the SCNs, are really a key resource for Alberta's health system. Our job is to help get evidence into practice and to improve the outcomes in the health care of Albertans. And in doing so, we're trying to build an integrated and sustainable health system on a provincial scale. I will say that the SCNs are also known as engines of innovation. So not only do we try and find new evidence, existing evidence, or new evidence that we like to try and bring into the system, and in doing so, we think we're innovating the way we do care delivery in the province.
So when did they come about, I guess?
Yeah. So as people may know, Alberta became a single province-wide health system in 2008, and it was in 2012, January 2012, when we launched the first 6 SCNs. And because the SCNs work across all institutional boundaries and really are provincial in nature, following the journey of a patient in their clinical conditions, we're really lucky that we have a provincial health system, because it has really enabled us to think about looking at unwarranted variation, trying to improve care, clinical appropriateness, and health outcomes, and do it across the province. So if we bring something innovative to Medicine Hat, we'll bring the same innovation up to high-level Alberta. And that way, all Albertans get the same access, and they can be provided with the same quality of care regardless of where they live.
So how many SCNs exist?
Well, we currently have 16 strategic clinical networks, and actually they are they're organized in kind of 3 different ways. They're either organized around populations of interest, so maternal, newborn, child, and youth, or seniors. They're organized around our more disease clinically orientated conditions, such as cardiovascular health and stroke, diabetes, obesity, and nutrition. Or they're focused in on certain sectors of our health system: the primary healthcare integration network, the addictions and mental health, surgery, critical care, emergency. So they're not all completely identical, but they serve populations of value and interest that are important to Albertans.
Okay. Could you give me a few examples of some of the projects undertaken by the SCNs?
Sure. So one project that was completed through the seniors SCN was a project called Appropriate Use of Antipsychotics. So for whatever reason, probably about 1/3 of patients in long-term care facilities often are on antipsychotic medications that at one point probably were prescribed for appropriate reasons, but over time they may not actually be of value to the senior. And so the appropriate use of antipsychotics was to try and wean patients from these medications, because A, they're not adding value, and B, they may actually be causing harm, so that they were able to be managed in long-term care in an appropriate way. And Alberta had an overuse of antipsychotic prescriptions in long-term care patients that were no longer reasonable to be part of their pharmacy or polypharmacy. So we endeavored to remove these antipsychotics from the patient, and obviously we wanted to monitor the safety and make sure that there were no untoward effects for the clients. And we went from probably being having a prescription rates of about 35% down to under 17% across our first 11 long-term care sites. Then we were able to spread it to all 170 sites in Alberta, long-term care sites. And we're now doing the same project in supportive living. And so we're feeling like we're providing better quality, safer care at a lower cost. And many of our clients without the antipsychotic medications are actually way more alert, and their families have told us that they are doing very, very well. They're more awake, they're more responsive, and so it's been a real win-win-win for people. That would be one example.
So this podcast is primarily about patient engagement. So let's talk about some of the work that the SCNs have done with the public and patients in their work. Do you have any, like, what generally, what kind of things do you do, and maybe an example or two of the roles that they play?
Yeah. When we started the SCNs, we wanted to be very, very deliberate about including Albertans and citizens into the network. So each SCN has a core committee, and that core committee is made up of clinicians and managers and policy and researchers, and we felt it would be very important to have patients and families and citizens sitting around that table, because if your job is to look at areas where we're not doing well and use data and evidence to improve the health system, we felt that it would be important for citizens and advisors to be able to give their perspective on what would be most important to them. So every SCN has a minimum of at least 5 or 6 advisors on their core committees, and they're supported by each SCN, and we also have a core team that makes sure that we support patients and families by bringing all the patients and families together as a group across all the SCNs, and it's called the Patient Engagement Reference Group. And just to make sure that they're feeling supported, they're feeling heard, that that their advice and their engagement in the work of the network is not tokenistic and it is really valuable. So a couple of things we've done with our patients advisors. One of the things that a lot of people feel it adds a lot of value is the storytelling, like what has the impact of my experience been, or the changes in the project work we've done, what impact has that had? So each advisor has a digital story, and they're all on our website. People can access them. And some of the stories are very positive, but some actually speak to where we haven't done such a good job. And it's been a really great way to mobilize the health system to want to do things differently. The other thing that we've done with our advisors is we've created an SCN liaison guide to best practices around engaging patients in this work. And some of it, just because you say, well, I've got a patient at the table, if you haven't sought their input, if you haven't done things that really help them co-design, agendas, content, solutions, then in essence we probably haven't done our job well. So we've now got a best practice guide on our website that speaks to how do you do this well. The other thing I wanted to say, Paul, is that, so has it made a difference? I want to give you a really good example of how having patients around the table has changed the discussion and the dialogue.
Please.
The Bone and Joint Health SCN was, when it was first formed, one of the things that all of the clinicians and people were talking about was obviously waiting lists and waiting to get in for surgery for a hip or knee replacement. several of our patients on that network obviously have osteoarthritis. And when we started to try and problem solve around what do we do about the wait list, it was a patient who said, well, you know, I would really appreciate it if you'd start to think about not lining me up for surgery. In other words, what can I be doing? I'm early in my osteoarthritis journey. What can I be doing to conserve my joint or prevent myself from actually having the surgery? Because right now, I sit at home, I'm on some pain meds, I can't exercise, you know, I'm gaining weight, I'm getting depressed because my lifestyle is deteriorating, and then 5 years from now, you're going to operate on me when I'm in my most deconditioned state instead of it being conditioned. So the whole room stopped, and one of the rheumatologists at the time said, holy cow, we haven't even been thinking about that. We've just been so focused on the surgical treatment. So the Bone and Joint SCN went out and said, well, who in the world is doing conservation management for osteoarthritis, and what are they doing? And we found a program in Denmark called GLAD, which is exercise, pain management, nutrition program for people to use in order to try and help prevent the deterioration of their osteoarthritis into the requirement for surgery. And in Denmark, what they found was that by doing this program, people were losing weight, their pain was significantly dropping, and their mood and their quality of life went up. So we brought GLAD to Alberta. We started with the first 12 sites in Alberta. We trained 12 private sites. Now we've trained GLAD training in our publicly funded physio and community rehab sites, and we're now offering GLAD to people. We're trying to get them as early as possible, but we're offering it to people who are waiting for hip and knee surgery. And just recently, because of COVID, we've actually, because people can't go, it's a group exercise program for 8 weeks. Because we can't get people together, we just converted the whole program to a virtual platform, so people who are at home and whose surgery is delayed because of COVID can get access to the program. But that's a perfect example about what's meaningful to patients has been expressed, we've acted on it, and now we have created that delivery capability here in Alberta. And we're evaluating the effectiveness of that program.
Okay. Could you tell me about how you do that?
Well, what we're doing, we have a scientific group that are evaluating, like, are we getting improvements? Are we slowing the speed to line up for surgery? What do patients think about the program and the way it's delivered? And so that report will be coming out in the next couple of months. But I think it's a really good example about designing the health system with the voice of patients and what's meaningful to them.
So maybe let's think about the future then. So what do you think the next 5 years look like for patient and public involvement in the work of the SCNs?
Well, we have, I think the future, we are growing in terms of our patient and public involvement in the work of the SCNs. We have actually been training patients as engagement researchers. We do have a little program we started here at the U of C called PACER, and all of our SCNs have trained PACERs involved in the networks. And what we're finding is there are more and more patients who A, want to take the program, B, are getting involved in research projects and co-designing questions of relevance for research so that they can get answers to things that are important to them. And we've seen a lot of examples of that in the SCNs, and we continue to sponsor patients to get to take the PACER training and then work with us to evolve the evidence that's meaningful to citizens. The other thing that we've been doing with the public is a program called Healthcare 101. So how how do we inform and guide people in the use of the health system? Most people don't actually know how their health system works. They don't understand the system until suddenly they're in it. So we created an online tool called Healthcare 101 that was co-designed by the public and patients, for patients. And what we've heard from citizens is it's great. That was a nice overview of how the system works. Now help us to navigate it. So we're working with the Imagine Citizens of Alberta, and we're working with the SPORE platform and the SCNs to come up with a way of improving our capability and ability to navigate the health system, and patients and citizens are co-designing that with us. So I think the future is we're taking on more and more ideas and health system redesign that has patients and citizens front and center.
Awesome. So I always like to ask people in the podcast for some advice. So what advice would you have for anyone listening who might not be involved in patient engagement or research in any way, who might want to get involved in any of the SCN research projects?
Well, my advice would be if you go to www.ahs.ca, there is, and you search for strategic clinical networks, there's a way for you to get involved. You can actually look through the different networks, and you can look through some of the work that they're doing. And if that interests you, you can just email them, and they'll get back to you. Alternatively, you can go through the Methods Hub and the Patient Engagement SPORE platform and get involved in the registry. And then we are working with the Patient Engagement platform to ensure that as people put in the registry their interests, we can draw upon those when research activities and projects are up and coming.
Thanks so much for joining us on the podcast today.
Thanks so much, Paul. Appreciate it. You have a great day.
Yes, you too.
Thanks so much for joining us for this episode of Pep Talks, the Patient Engagement Podcast, brought to you by the Alberta Strategy for Patient-Oriented Research Patient Engagement Team. Special thanks to Paul Ferry, Sadia Ahmed, and Sandra Zielinski, and our summer students Sarah, Sydney, and Stella for their co-production. Make sure to subscribe to this podcast wherever you found it, and we hope you'll join us again for more interesting discussions about patient engagement in health research and healthcare.